Hi, welcome back to the Marina Kuperman Show. Today, I'd like to talk a little bit more on a topic that was previously discussed. And the topic relates to fertility. So as I mentioned before in one of the other segments, there are ways that women can check for their fertility. There's a hormone that can be tested through blood work. And you can feel free to reach out to me or your provider to find out more information about how to go about doing that. But I received some questions from people about wanting to know more about how to test for fertility, how to check the status of your fertility. And so I wanted to give you a little bit more information about that today. So there is a hormone that can be tested that will tell you approximately where you stand as far as the immature egg cell count in your ovaries. It doesn't give you an exact number. Like, for example, she has 5,677,000 eggs left. No, it gives you a range. A low, a medium, or a high range. And just to touch base on a couple of things as it relates to that, women who have low egg reserve typically are those who are closer to menopause, typically. So closer to menopause, your egg reserve is obviously lower than when you're in your 20s and 30s. Normal egg reserve is usually someone who ovulates regularly, someone who is in their 20s and early 30s. It's typical at that time to have a normal egg reserve. Someone who has a higher egg reserve can also be for various reasons. One issue may be something called polycystic ovarian syndrome, where women don't ovulate regularly, or someone who's been on birth control for a long period of time and for one reason or another has that increased reserve. So there are tests that can be done if you wanted to check where you stand as far as your fertility. Those numbers do change, so it will tell you here and now. That number may be different 6 months or a year later. If you need more information, or if you're interested in finding out how to go about testing your reserve, feel free to contact me at the office or write an email. Thank you so much for watching.